So right now we're going to perform the entire hip exam in a very seamless, fluid way. We're going to start off by having the patient stand up, and we're going to palpate the sacroiliac joints. So in order to do that, like this. You want to palpate first the posterior superior iliac crest, and then a couple centimeters below that, you're going to feel for a ridge bilaterally, and that's the sacroiliac joint. Now have the patient sit down. Great. Well, now we're going to do the Ludloff test. So I'm going to have the patient cross their arms, lift your legs straight up into the air. Excellent. This is an exam maneuver that will test for iliopsoas tendinitis. Now I'm going to have the patient lie flat on their back, supine position. And I'm going to first assess range of motion. And by assessing range of motion, I'm helping to evaluate for conditions such as osteoarthritis. So I'll start off with a log roll. I'm going to flex all the way as far as I can. Excellent. Come back to the center, and I'm going to externally, internally rotate. And I'll jump right into the Fader test. The Fader test is used to help diagnose a condition called hip impingement. So I'm going to, again, hip is flex. I'm going to adduct maximally and then internally rotate maximally. I'll then perform the Scour test. And the Scour test diagnoses both hip impingement and the labral tear. So I'm going to keep the leg about 90 degrees, adduct, apply an axial load, and I'm going to internally and externally rotate. I'm going to then abduct, apply an axial load, and internally and externally rotate. I'm then going to perform the Faber test, and the Faber test is used to diagnose sacroiliac joint dysfunction. I'm going to place the patient's foot right on top of their knee. If they're not flexible, you can always place it right on the table. In this case, you're very flexible. I'm going to apply some counter pressure right here on the contralateral hip, and then I'm going to drop the knee down to the table. And if that reproduces right lower back pain, that's consistent with sacroiliac joint dysfunction. And they're going to have the patient keep their legs straight, and I'll perform the Stinchfield test. This is another exam maneuver that will help diagnose iliopsoas tendinitis. So lift your legs straight up into the air, apply some resistance. If they have growing pain, that's consistent with iliopsoas tendinitis. And I'll have you lie in the fetal position. I'm going to palpate the Greyer trochanter. That helps to diagnose trochanteric bursitis. Again, it has to be exquisitely tender. And then I'll perform the Ober test, and the Ober test diagnoses iliotibial band syndrome. So have them stay in the fetal position, take the top leg, keep it in line with the rest of the body, and then drop it down below the level of the table to stress the iliotibial band. And that is the entire hip exam.